All right, it looks like it's 12:03 on my clock, so we'll get started. It looks like we've got pretty good attendance. We've got a couple of our guests here, it looks like, too. So we'll call the meeting of the Rotary Club of Wausau to order. Thank you all for attending. Any announcements at the beginning?
Matt, the Hunger Plus committee is going to be regrouping soon for a March Hunger Plus ask for the first quarter.
Okay, so that's great, Patrick. So March ask of the club. So try to have that the campaign begin and end during the month of March. Is that the
Correct
plan? Okay.
Yes, sir.
Good deal. Do you have a specific any specific kind of project in mind at this point in time, or to be determined?
No, not yet.
Okay. All right. Fair enough. Other announcements. Deb, anything on your list? Okay. Dennis, anything on your list from the district level or anything like that?
We are planning on the district conference, and it's going to be virtual. And I am actually looking through my emails. I got so much emails about the district conference coming up in this summer. Give me a second here. Let me tell you the date so you guys can start putting in your calendar too. And I'll also email Deb about it, so if we can put it on the email to all the members as well. And the date for the meeting is, I tell you what, just keep going. I'll put it on the chat.
Okay, sounds good. All right, I have another commitment that has come up this morning that I've got at 12:30 today. So Kelly Fisher, our president-elect, has been kind enough to agree to take us home for the balance of the meeting. So to our speakers, I apologize. I'll probably drop off in the middle of your talk, but I'll catch the recording. I guess we should probably announce that we're recording, given who our speakers are today. But in any event, all right. Anything else that anybody's got for announcements today? All right. Pretty light day. We'll start with happy dollars. Because we don't have as many announcements, I haven't been able to round anybody up. So Patrick's got, I'll coordinate happy dollars and sad dollars today. So Patrick, you're up.
Well, I thought I was going to put in a sad dollar, but I found my long underwear.
That was in one of your storage units. I know you had Patrick, when you downsize like you've done, your long underwear ends up somewhere where it's not all that handy, huh?
Right.
Yeah. All right. That's a good happy dollar. Other happy dollars?
Yeah.
Brad.
I'm going to put a happy dollar in just for our guests here. And I know they have a really great, topic to talk to us about. And I think it just reflects, just the wonderful police force we have. But, when you're a high school principal, sometimes you face things that aren't always going right. Anytime you get 1,000 students under one roof, things can happen. And I look back on my career, I cannot thank the Wausau Police Department enough for their professionalism. And even sometimes when students would make bad choices, the police department was always there to help them learn from it and become better citizens, better people because of it. We're so blessed to have the police force that we have in Wausau, Wisconsin. So I want to put a happy dollar in just for the guests that we have today from the Wausau Police Department. It's really great seeing you all again.
All right, well deserved. Brad, before we move on from you, I'm looking around at the faces and Zoom's not always great for this, but do we have other youth Rotars that haven't been in attendance yet this month that we probably need to introduce this meeting?
I don't believe so. Thanks for asking. Is there anyone here that wasn't here yet this month? don't think so. I was kind of looking over names and checking my forms here. So, nope,
Okay.
Mr. President, I think we're fine. Thanks for
All right.
asking.
All right, fair enough. Other happy dollars.
I have some, I'll put in 5 happy dollars, sort of happy dollars. I am talking to you today from the Panhandle of Florida. And I'm happy because we got down here in between snowstorms and ice storms. And it's sort of happy because it's 60 degrees and foggy. But I'm here.
Whereabouts are you in the Panhandle, Kelly?
Fort Walton Beach.
Fort Walton Beach. All right, very nice. And you must have driven down. You guys drove down. Is that right?
We did, but we take 2.5 days, but we tried to do it in 2, so we had 2 long days, and we got out before it started.
Uh-oh. Are you back, Kelly?
Yep.
You can hear us? Okay, you froze up there for a second.
Oh, I'm sorry.
That's okay.
Take a drive over to NAS Pensacola, to my old home. They got an outstanding aviation museum.
We've been through there several times. The base is closed to anyone who does not have a Department of Defense ID.
Oh, my.
Well, the last time I drove back, again, this is ironic given who our speakers are today, but the last time we've been down there a couple times, I guess, for spring break. And when I got back the last time from there, about a week later, my wife walked into the bathroom as I was getting ready and tossed something on the counter, and she said, "I think this is yours." And it was a picture of our vehicle. It's actually her vehicle. I was driving, going through one of those little towns in southern Alabama faster than I was supposed to be going. So that was my welcome back. Or I'm sure they look for out-of-state license plates and get them in particular. But anyway, I'll put in a sad dollar for that bad memory. So.
Oh, and trust me, having lived in Alabama for multiple years, it's got nothing to do with out-of-state plates. In-state, out-of-state.
Doesn't matter. That's how they fund their budget. Is that right?
That is, yes. That's a well-known community, if I'm thinking of the same one.
Well, I think I talked to you. You know, there's also inevitably a traffic jam in rural southern Alabama, out south of Birmingham, that you can't figure out why, but it is just every time I've driven through there, it is stuck. Yeah.
My youngest brother lives in Alabama and outside of Birmingham. So yeah, he talks about the speed traps and everything all the time. So yeah.
Anyway, all right, I digress. Other happy dollars. Sad dollars. Fess up dollars. Anybody had any press lately? Dr. Dodson, I see you're on. I don't know if you're able to comment. I always like to hear your latest updates on our pandemic efforts in Marathon County. Any thoughts today?
Hi, just trying to get my screen open here.
Oh, no.
Yeah, I think that we are still seeing a lot of problems getting vaccine sort of the last mile, so out to smaller communities particularly. However, there does seem to be some light at the end of the tunnel, more vaccine being purchased and released by the federal government, and then also some agreement maybe finally amongst the executive and legislative branch about how to do some things. So I think we're hopeful that we're going to start seeing the supply increase and get more of our vulnerable population immunized. The latest projections I found really interesting from the University of Washington data center that's looking at this. is that if we get immunization rate, if immunization rates don't hit at least 70%, and people don't continue to wear masks even after they've been immunized and practice social distancing, that we'll probably see another surge in late May, sort of another blip. If people continue to get immunized, get our immunization rates above 70%, and we see people behaving in the ways that we would like them to with social distancing, et cetera, continued, then that risk really drops down significantly. So just, I guess the message is, even if you get immunized and even if you don't get immunized, continue to practice social distancing and masking and, you know, all the other stuff. So I guess that's the update.
Okay, thank you.
How has Lisa, how do you see, or what is the research showing that these new variants are going to impact a possible surge?
Yeah, that's a big wild card. So certainly the UK and the South Africa variants are the ones that are of most concern, and they're starting to kind of creep throughout the United States. Basically, it's, again, if immunization is slightly less effective in those two variants, but if we get our immunization rates high enough, it won't matter so much. So I think what it affects is when you look at the R value or the R naught value, that people talk about how many people you're likely to expose, that as that number goes up, and it will go up with these variants. So with COVID, the generic, COVID, it's about 2. And with some of the variants, it may get as high as 3 or even a little higher. Every time that R number goes up, you need to immunize a higher percentage of the population in order to get herd immunity or herd prevention. So basically, if those take off as much as we fear they might, that would mean we need to get a higher vaccination percentage rate. If we get new variants that actually increase the virulence rather than the transmissibility, so these two variants don't make it worse, they just make it more likely that it will spread, so which then of course exposes more people, which creates more problems. So anyway, I think that if we don't see new variants that actually make it a more virulent virus or a stronger virus, then we should be okay as long as we can, again, get our immunization rates up.
Okay, thanks, Lisa. Always appreciate those updates. Last call for happy dollars, sad dollars, fess up dollars.
Lisa reminded me, I'm going to throw in a happy and sad dollar. I'm a happy dollar. My husband works for North Central Healthcare. He got his second shot on Friday. My sad dollar is he was sicker than a puppy all weekend. So the first shot, he had no side effects whatsoever. But Friday's shot put him down, feeling like he got hit by a truck. But so unfortunately, so I'll throw in those two.
Okay. All right. Well, I think that brings us to our speaker. Sean Wright, I think, is here to introduce our speaker or perhaps speakers today.
Yeah, absolutely. Really glad to have these individuals with us. Obviously, the homelessness issue is something that is prevalent in our community more so than many of us would even realize or like to admit, particularly demonstrates at times like these when we have absolute bitter cold for weeks at a time. Wausau PD has been working on a really groundbreaking is a good word for a program to help attack this problem in our community and find a way to provide resources for those individuals and find ways to better serve them. So we're happy to have the officers with us today and look forward to hearing exactly how this problem is being tackled and the innovative ways that you're addressing it. So please welcome, and we're glad to have you gentlemen with us.
Well, I'll start out. Hi, I'm Nate Seiler. Anybody hear me? Somebody give me a thumbs up. Good to go? Okay. So I'm here with Officer Eric Lemerand, you'll see, and then Monica Minesberg is our peer specialist team member from North Central Healthcare Center. So Thanks for having us. I think the last time I was here, I think we talked about CART, which is our mental health program some time ago. And I'll talk back to Dr. Peck here. Starting up the Zoom meeting and hearing a voice and turning around and like, oh, I know that voice. And I kind of forgot to expect you on here. So thank you for the kind words. Really appreciate that. I still remember the first time I met Dr. Peck in person was actually at the 2012 Rut and Run event from the Rotary back at Red Mountain. So I still remember that when I first got started working with the schools, and very thankful for what I've learned from all our school administrators. In my position, I supervise the school resource officers, and working with the school administrators has been a great learning experience for me, the school resource officers, and just how we as police approach the youth in our community and our school community. So right back at you, Dr. Peck. Thank you for your leadership and your time and helping us out. So
Thank you.
So with me, Officer Limrand has been here since 2009 as a patrol officer. And then Monica joined us back in September. So you'll see she's actually working out of the police department now too. But we started this in September, late September, I should say we, but Chief Ben Bliven and Michael Loy, CEO of the Healthcare Center, is also a police and fire commissioner. It talked about just trying to find a new creative way to see how we could impact the chronically homeless population in our community. So we're really focusing on, when we say chronically homeless, it's these largely adult single individuals with substance abuse and or mental health issues that have a lot of barriers to housing, despite some housing being available and some help often being offered by our officers. These are individuals who, for a number of reasons, are not comfortable accepting the help, or just have some of these really large barriers to being to be able to stay in stable housing and move forward. So we sought out to try to identify those individuals and really intentionally and aggressively do like social work essentially with them to see what kind of impact we could make with them. So with that, we're looking for an officer within our ranks who's going to be able to commit to building relationships and building trust with some of these individuals to try to change their perspective of police. And then also reached out to the healthcare center to see if they could provide somebody. So the two organizations each provided a staff person off the roster to go at this full time. And then we got some support from the Green Neck Foundation with a substantial grant to help pay for a lease for a house here on McClellan Street to be able to house some individuals while we work with them. So since then, there's numbers of stories that we could share that Monica and Eric have told me about, and I can certainly fill in if they find not enough to talk about, but I'm gonna go ahead and let them each introduce themselves and kind of their current role and experience and what they found out so far.
I guess I'll start. I am Eric Lemeron, a patrol officer for the Wausau Police Department. Let me just first thank you for the invite here. What we're doing with this initiative or pilot program is very important to our community and to our whole community with what we're seeing. And whether you know it affects you or not, it absolutely affects all of us. I appreciate coming to the Optimist Club. I believe my father retired as an optimist. I think my mom was in Kiwanis, but we won't talk about that. I know I recognize a few faces here, Dr. Peck and Deb, some names. So it's a pleasure being here. One of the things we've done is, when I started, I had to build those relationships. I didn't have initially Monica till about 2 weeks into my tenure in this spot. Just go down there, find out, talk to people. What do they think their homelessness is a result of? What are the barriers they're facing to get them out of homelessness? And, it's very individual specific. The situations may be similar, but the resolutions typically are not. And, everybody thinks of homelessness as a sort of a linear problem for these individuals. And sometimes it is, but typically it's not. It's more of like what I would say a spider web, where you don't have to solve this problem and then this problem, and before you know it, they have a house, they have a job. especially dealing with the substance abuse, it's more of we'll get a little bit of this over here and a little bit of this over here, and unraveling that web to help them find what they need in resources. One of the things that's fantastic about this position is we have a wonderfully resourceful community and very generous. There's nothing that I've been able to do that hasn't involved partnering with an organization here in the Wausau community. It's ridiculous how I say easy it is, not because it is easy, but it's just a matter of finding the right person to say yes. And I've yet to run across someone who hasn't been able to say yes with the need that I have to help these people. So to include people from your club, this is a great community, and I'm proud to be a part of it, to bring this initiative to help resolve our fellow community members. We've been able to help about 10 people find housing. We've had 3 people go through treatment. One of them is still successful in his sobriety. I am, as of Friday, going to uphold a promise that I promised a female individual who was homeless and get her back to Southern California, where she spent a majority of her adult life. Using community resources, I'm going to go with her, take her. I found a treatment facility that's able to take somebody out of state who then can help her get back on her feet and assist with both mental health and substance abuse. Once she's done with that, then they'll assist her in getting housing and finding how to support herself. So, I mean, the impacts that we're able to make are significant and substantial, and very good for our community. Monica, do you want to introduce yourself and speak a little?
Sure, thank you. I'm Monica Meinsberg. I, as have been told, work with North Central Healthcare. I am a outreach case manager. Eric did start the program about 2 weeks before I was brought on with him, and it has been a wonderful partnership. We're kind of like fire and ice, but together that works out pretty well with the community we're working with, depending on, everybody needs a different way to be talked to and reasoned with. Sometimes I go in with the soft side and Eric comes in with the big hammer, and sometimes that's just what they need. So it's been really awesome. The first, I'd say, month we were out at the downtown gazebo, if you guys know where that is downtown, just sitting with them, talking with them, getting to know them, building that rapport with them and that trust. I think that was incredibly significant to this program, because they don't trust many people, especially with the officer, Eric, being all in his uniform. At first it was a little difficult for him because they wanted nothing to do with him, but now they trust him fully, pretty much. They know he's not there to harm them or take them to jail or get them in trouble. He just wants to help. And that not only has helped him, but it's helped the entire police force, I believe. And it's also put a great name that they're willing to help, because we know this, but as we know, the media has kind of made police officers look bad, and that's not the truth here in Wausau. We have an excellent police force, and I'm excited that North Central Healthcare decided to partner with them and work on something that's important to our community and to those people. And hopefully we get to continue to make a difference and continue this program. As Eric said, the community has been very generous with donations, helping us get the things that we need, whether it be for the house or for individuals that we've gotten housed. There's just been almost an overflow. Like there's some things where we're like, we actually have too much of that right now. So it's been really awesome. And I look forward to continuing this work. And yeah, that's all I got.
All right. Well, thank you both. I mean, I'll add in a few things. I'm not sure how much time we have here. I wasn't involved in the planning part, so Sean, I don't know if it was 15 minutes or half hour, but.
You got all the time you need.
Okay. Yeah, they hit on the key points was building that initial relationship. And I think what what I've learned from Eric and Monica, because I wasn't out there boots on the ground with them, but you know, our officers were called to or encountered these individuals downtown on a daily, nightly basis. Every shift dealt with them, sometimes the same people over and over again. And we're constantly applying Band-Aids. And the officers wanted to help and to try and connected them for that day and got them to the next day. But you know, we never really got to know these individuals. And once Monica and Eric just started talking with them and they got a little more comfortable with having an officer around, then you hear what their backstory is. And then we can finally, you know, we can finally find out what the root cause is for that specific individual and provide, you know, whatever unique resources or things that they need in order to be successful. And just hearing sometimes initially in the first 2 weeks, there's a couple of them that just, oh, you know, we learned that they got disconnected from family. Well, where's your family at? It was just a matter of reaching out to those family members. And pretty quickly, we got 2 people that hadn't moved out of downtown Wausau in months or years and just simply reconnected them with family out of the area. And we got really creative with Eric can use his time to transport people, to make phone calls. We have a small fund to, you know, take care of buying somebody a meal, whatever it is, to get them reconnected with family. And so once we learned more about them, we could really, it's the follow-up piece that we were never able to do with just patrol officers who had to deal with their other calls of service. So now that with Eric and Monica being able to kind of be there for them as mentors, once they built that trust, these individuals now reach out to Eric and Monica for help. So Eric has his own cell phone. They're calling all the time for different things. And there's, you see some hope with some of these individuals we haven't seen before. Some of these names that our officers and their staff have known for a long, long time that just haven't been able to get anywhere with, but just building that relationship with them that they can trust us now. And we've seen some pretty good progress in terms of treatment and being able to keep people in housing. So in addition to the house on McClellan Street here, Eric and Monica have had stories of just what it takes to get somebody into their own apartment. So we've been able to help people secure their own private apartments for a number of individuals, but sometimes it's, you know, they don't have a driver's license or an ID. They got a Section 8 voucher, but they don't have the right things to apply for that. And sometimes it just gets overwhelming for them. So Eric and Monica, it could be a full day or a couple days worth of work just to get them where they need to be, transport them around to, they need a birth certificate to get a driver's license. And that costs money. There's a fee associated with that. Just getting them from one step to the next to ultimately get an application that's acceptable and get them into an apartment. But as we know with a lot of these individuals, getting into the apartment is a victory, but there's still a whole battle that has to be won in terms of their you know, substance abuse or mental health disorder, whatever it is that they have going on. So we've gotten to a point where Eric and Monica have gotten a number of people situated, and almost feels like we got all these plates spinning, and we're starting to see like, well, this is how many people we can handle in terms of a caseload to make sure that people aren't falling off the rails. So once we find that initial success, a lot of them just need a lot of ongoing help, support. Some of them are just daily. We have stories where, you know, we missed a contact or we're dealing with somebody else for the day, and somebody who's been drinking every day for several years in a row, it's a hard thing for them to break. So we're trying to find that balance with who we give our attention to in any given day to try to help more people be successful. And ultimately, we're trying to identify gaps for future funding. So in the end, we can say, here's how many people with an officer and a peer specialist, here's how many people we can handle, here's how many people we can make successful, but we still have a lot of more people that need help, and a lot more people who are still going to be down at the gazebo unless we have more resources. So in the end, that's our report back to the foundation and to our respective commands is, you know, here's what 2 people can do in this amount of time, but it's not enough. There's only so many hours in a day for our team members, and these people need intensive help for a long period of time. So it's more than just getting them housing. It's that ongoing maintenance that really takes up a good amount of Eric and Monica's time. So Eric talked about partnerships. Some of these people, like the one you mentioned in California, seem to get kind of stuck here because even though they're not from here, all it takes is one incident where they get arrested for disorderly conduct, lewdness, lascivious behavior, what have you, downtown, and now they're in the system. They have a court hearing. They have to stay here. Now they have bond conditions, no drinking. Well, they get back out right away, and what do? An officer finds them drinking, so they bring them back into court. And sometimes they don't want to be here, but now they're stuck here because they're caught up in the system where they have pending court cases. And what am I going to do in the meantime? I'm going to drink. I'm going to be down at the gazebo. And so we've really been given a little more discretion and just really decriminalizing homelessness and trying to give them a little more leniency and working with the public defender's office, the DA's office, probation, parole. We have good relationship with the social worker up at the jail so that we're all on the same page when it comes into court. You know, Eric's working with these individuals that let's make sure they have a plan when they get sentenced or released back into the community. Let's make sure you have a place set up for them. And so now we have individuals, when they go in court, they have a whole team of people around them that kind of work together to let's not just get through today with court so they're back out on the street causing another problem. Let's have a plan set up for them or to either get them into treatment or get them into housing. So that has been a very, even for one individual, that can be several days process. So it's been small steps, but we're seeing enough success where we do want to continue it. It's a matter of whether we're going to make this position of Wausau PD be a full-time position. It would require us to acquire another position through city council. So we'll be looking at this spring and the summer to see if that's going to be viable or not. It's my understanding the healthcare center though has already going to have a full-time position where Monica is at. And they've done a lot in terms of opening up more treatment options, or I guess more immediate treatment. So when Eric and Monica have somebody who they're ready to go into treatment today or tomorrow, we have that spot open for them, where some of the roadblocks in the past is the waiting list for psych appointments, for substance abuse. Same thing. They just don't have enough staff to take all those appointments right away. So there's just this waiting list. But we found some more success when we open up, we prioritize some of those psych slots, substance abuse treatment for these individuals that we're working with. So that's been very helpful. The healthcare center is going to continue to work with us on that. So we're kind of looking at a target for April, May is my feeling, to kind of reassess on how long we're going to continue this and what kind of impact we've had over the winter, and then kind of see what the gazebo downtown looks like with our population at that point. So I could go on for a while, but
well, Nate, I'm sure we appreciate everything that you and Eric and Monica are doing, and I'm sure people have some questions. I'd like to start off with one. And you talk about, you know, the great need that still exists. Can you guess in terms of how much of the population you've been able to help? I mean, how much is out there yet to be in terms of a percentage?
Well, I think when we started, I know Eric, correct me here if I'm wrong, I think we're looking at somewhere around 40 individuals that we had identified initially in this category of what we would say chronically homeless. So like the Salvation Army works with people that, it has worked with some of these people, but one of their conditions is sobriety to be there. So these are the individuals that we often find at that utilize Catholic Charities at the warming center during the wintertime. And I think that was around 40 or so when we started. Does that make sense? And then, so Eric, I guess, take it from there. I guess know,
I have on my, what I would call a roster, around 47 names. A few of those are not chronically homeless, but one of the roles we've tried to fill in doing this is preventing homelessness too. So people who are on the verge of being homeless that might take a little bit of a problem solving approach to keeping them housed. So I say about 47, including some of those individuals. I can tell you it was a lot more than what I thought were out there in our community. And it seems like about the time Monica and I go, okay, I think we know who all is out there and what their barriers are. Tracy Rieger from Catholic Charities or the Salvation Army or some other agency in town says, hey, Eric, I've come across somebody. So, you know, it's constant fluid movement in and out of this homeless community. Wausau has kind of become known to homeless individuals of, hey, let's go here. They got a lot of resources. So one of the goals that I have is to really set up this community with the homeless community with, yes, we're here and we have resources available, but we're not here for you to come and just relax and sprawl out and use our park and drink and take advantage of our resources. We're here to help you if you want the help. If you don't want the help, then maybe Wausau is not the community that you want to be a part of. And it's not. It doesn't come from an aspect of we don't care about you. It comes from the aspect of we do care about you and we want to help you. If you don't want our help, then you can maybe move on. And sometimes, you know, it sounds heartless, but it's really not. As a community, I think this is really the proper approach that we need to have, because we've established the gaps, we've established the resources and how to navigate those. And so I'm very confident that there's nobody here that we can't help if they're willing to take the help.
And Eric, I think as far as a percentage, if we started with 47, and I kind of jotted down some notes from the last time we met, and we had gotten 8 to 10 people moved into private apartments. 2 moved out to reunited with family. 1 in sober living in Hope House, which is the healthcare center project. We've had a couple people that we had good progress with, got into treatment, housing, but then relapsed as we expected. We've had some successes, but we've had some people that it's going to take a couple rounds, I think, before it takes. So out of those 47, my numbers, we have 10 to 15, those with the 5 of them been kind of moving in and out who we're still working with in terms of trying to either have relapsed or trying to get them back into housing. We have 4 individuals right now living in the McClellan Street house through that grant project. And one of our, we had some issues with COVID, of course. 1 got sick, well, then another one got sick, and we ended up having COVID in the house, which good thing was we feel that it probably saved at least 1 or 2 lives based on how sick a couple of them got to have them there. We also felt that we were able to quarantine them then more and not spread it further in the community or within that population. The downside was it really delayed Eric and Monica from being able to move them forward with services. But within the last 2-3 weeks here, we've gotten job interviews for them. A couple of them Monica was going shopping today to get a tape measure for one of them who got it, his first job at Colby & Colby. We also have Crystal Finishing has been a good partner with offering some job opportunities for individuals. So we're getting to the next step with some of them. We're helping them keep them sober, getting them to job interviews, finding clothing to do that, whatever they need, and then ultimately getting them to work. So.
Could I, this is John from the club, and I thank you for your presentation, but can I call upon Brad and ask for the families that you find that are parents of students that are homeless families, how much of that's happening and how involved is the task force in assisting that? Can you explain the intricacies or involvement of the task force resource and what you've experienced, Brad, and what the schools in town experience for homeless families?
Well, this is relatively a new start. I mean, and I am so happy to hear this because, oftentimes we do have a lot of homeless families in the school districts. And a lot of times what's really difficult is, and I think that Eric and Monica and Nate have touched on it, is that when you're dealing with parents when there's mental health issues or there's substance abuse issues, or one of the parents ends up in the system, just like Nate was saying, and Eric, it's a vicious cycle, and it's very, very, very difficult to break. So, I am just so, I give you so much credit, Eric, Monica, and Nate, because you're getting right down to the root, to the grass level. It's so easy for a community to just turn their head and say, that's why we have the United Way. I hope they take care of those people. It doesn't work that way. It's one-to-one, building the relationships that Eric and Monica are doing. But when you're dealing with mental health issues and you're dealing with substance abuse issues, those things have to be addressed. And I'm really glad you're doing it in a place where they can stay. One of the things that nobody wakes up, from my experience, and I'm sure you can, you concur, nobody wakes up and says, well, today I think I'm going to be homeless. Or nobody wakes up and says, I'm going to be a drug addict, or I'm going to, really work on having some poor mental health habits. These things occur oftentimes from variables that are outside of their control. I guess the question that I have is, and you've kind of all touched on it, but, like Monica, when someone wants help for a mental health issue, it's hard to self-impose that type of help on someone, and I get the fire in the ice business, or with the substance abuse issue. Does our community have the resources to assist people that want that type of help? Like a person bottoms out to the point where they realize, hey, my kids are impacted by this. I need help with this substance abuse. Do we have the resources, adequate resources to help people like that in the community?
So actually, with COVID, it's kind of messed a lot of things up. I'm sure you can all attest to that. With North Central Healthcare, we used to have the MMT program, which was an AODA treatment center, 28 days. We do have the crisis center. Unfortunately, there are some issues with the crisis center as well, as far as being able to get someone with substance abuse in there. I mean, we have a lot of mental health issues in the Wausau area as well, and the crisis center is pretty adamant on getting people in there who are at immediate risk to themselves or someone else, as far as suicide and homicide, and working with them on those things. So for someone with AODA problems to get in there, it can be very difficult. Thankfully, we have been working pretty closely with Ellie Phillips in Chippewa Falls and able to get some people there for medical detox, which is something that is very necessary for this community because of how long they have been addicted, and how much they have been using. And with MMT now closed for treatment, we actually are using some of the grant money that we got because it was closed to be a COVID unit to send them elsewhere for treatment. But those are typically only, with the COVID again, one, have longer waiting lists, and two, are only 28 days. And this specific community, it's going to take typically more than 28 days for someone to get through detox, get some help with their addiction, get a little bit of sober time under their belt, but then to relearn how to live, 28 days is pretty quick turnaround for them. So I do think we are missing some longer term treatment, definitely a detox center. There are some things we are missing, but that's definitely something that Eric and I are very aware of, and something that we will bring up as some needs that we do need in the community.
Yeah, I just think that what this program really hits on, and I really, really compliment you on this, is that, for people that are in that situation, to have someone they can call. You mentioned that at the beginning of your presentation, because that's oftentimes what happens. People get shuffled off to an agency, okay, you go here for help. But it's more than that. You need almost a mentor. You need someone to walk you through that. And the fact that you mentioned that they can contact you and call you, that's awesome. And then the fact that, self-esteem is so important, especially for someone that's on the streets. And you just mentioned at the end there that some of them are getting jobs. That is so critical to help walk them through that so that they can feel good about themselves and begin to restore that self-esteem and that pride, in being a contributing person. So it's tough work you're doing, and I give you a lot of credit. And Nate, I sure hope that the city comes around and can fund additional support for Monica and Eric to another position or something like that, because this is where it's got to start, right on the street. So boy, I really credit you, and thanks for the work you're doing.
Sure. And John, I have to further answer your question. The week of Christmas, Officer Stetzer, who's the school resource officer at East High, reached out to me and said, I have a student who's homeless. Her family's been living in a car. It's her mom, and her older sister, who's an adult. What can you do? Granted, we have a focus of a smaller group of individuals to really prove our concept, but I'm always willing to reach out and help those that I can, especially in this scenario where there's a student who's homeless. The student's 15, and I can't imagine being 15 and having to worry about my next meal or where I'm going to lay my head, or living out of a car in the middle of winter in Wisconsin. So I took some priority in that case and reached out to contacts that I've created in partnerships. And I believe it was the 23rd of December. I had found a place for them to move in on Christmas Eve. The officer that's in charge of our victims resource unit had some resources to get them a tree and whatnot. But we were able to work fairly quickly and find them an apartment. The issue is mom's mental health and possible cognitive issues. So now we try to work on that and figure out where that lies so that they can stay out of the homeless community. But those situations come up, and I think there's a definite priority in them because of the students' issues. And a 15-year-old should be worried about school and friends and those sort of things, not the adult decisions of meals and places to stay. It's in our community. It's not I don't feel that it's the biggest problem we have in our homeless community, but yeah, it's out there. And the good thing about me doing this is as officers come across these scenarios, they can run them by me and I can say, okay, I don't have time for that right now, or that's not a higher priority, but here's what we can do. And here's how we can help resolve it. And obviously with Officer Stetzer, I was able to help him out, but being that resource is important too.
Well, in that, and John, getting back to your question, high school kids all want to be the same. If I'm homeless or if I'm hungry, I don't want to stick out. I want to go to high school and try to be just like everybody else, and maybe get a hot lunch or whatever it is during. But I wasn't just blowing sunshine, at the start of this meeting. This is what they're saying is this is what really makes Wausau unique, is the communication between different agencies to say, hey, Eric, we have this family, like Officer Stetzer said, what can be done to help? And I know there are businesses that step up for food, they step up for clothing, but getting them into a place to live is what, Monica and Eric are talking about, Nate, and that's so important. But then again, as Eric mentioned, that mental health issue or that substance abuse issue, those are the big hurdles. And, but I think it's on the right track, and we've needed something like this for a long time. So thank you for your work on the streets.
Yeah, I'll say the Salvation Army, Catholic Charities, we're not here to replace any of those organizations. We're here to supplement, really, and that is we're delegated to really focus in on those chronically homeless individuals that have that substance abuse or mental health, that we've identifying those ones that have those barriers to housing, and or at least on the street, they're telling the officer, I don't want your help. But we know that we don't say that they're choosing to be homeless, but we know that they have these underlying issues that they haven't been able to get over. And so they've kind of lost hope. And so those are the ones that we're trying to be really assertive with, and almost to Eric's point, like making them a little uncomfortable. Like we don't want it to be for them. We don't want it to be comfortable for them to be homeless out at the gazebo. So we're going to almost be a bother to them a little bit to the point where they actually accept what we're trying to offer. And part of that is that they don't accept the help initially because they don't trust that we're going to follow through. No one's followed through with me before. Why should I trust you now? So that's the cycle we're trying to break with these specific individuals. Certainly there's a whole other segment of homeless individuals and families who are coming on rough circumstances, and they're looking wherever they can for help, and they want housing right now. And that's where Salvation Army and Catholic Charities, definitely, we still need those to kind of work those families and be there to help and be a place that can offer food and resources. We're really, Monica and Eric and this smaller team is a delegation of the larger, the Marathon County Housing Task Force formally was started actually, I think back in the summer, and that's more of that's the partnership with the city, the mayor, the police chief, United Way with Ben Lee is the individual over there. And that's the larger umbrella of, they want to create the community partner center where they're looking for this building to combine all these resources to really address homelessness and poverty overall. And out of that larger task force is what then came this, hey, while we work on that, let's get an officer and someone from the healthcare center to really go target this one specific population that is really hard to get at and hard to change, that we see downtown, or community sees downtown. We see these, not only, people, our community see it, but it's also become a danger. Every year, on average, one or two, we end up dying, falling into the river, freezing, what have you. And that's not something we want to see. So we're really trying to impact with our small group here, see what we can do with that core group of individuals as part of the larger housing task force, which also addresses families, students, all of that.
We have time probably for one quick question.
I'll pop one off. Guys, what can organizations like ours do for you right now? How can we help you now?
Deb, thank you. That's the tough question because we do have such a generous community. We have people who, again, want to give financially, volunteer. It's hard for Monica and I because we don't have a specific outlet for that. We've been able to accept monetary donations from community members and put them in a fund that we can use. Part of that fund is what we're using to assist this female in getting out to California and reuniting her with her home. I always suggest people that want to donate financially, we can take those. If you want to contribute items, we have a wish list for our residents, the house on McClellan Street. Otherwise, I encourage individuals to contact the Salvation Army, Catholic Charities, and Neighbor Place. Those organizations that are also directly impacting these individuals. They're always looking for volunteers, and that's where I would say those efforts could be used. I wish I had a better answer because I know, again, how generous everybody is, but that's probably the best answer I can give to that effort. And Nate, what can you add?
Yeah, we've had some monetary donations. We have an account here with the police department. I mean, just with the city of Wausau, and we pull out of that account for some of these incidentals that we run into. But Catholic Charities is probably our closest partner. Well, Eric right now he has an office space that Catholic Charities basically opened up for him at their office because we didn't plan on that initially, but it just made sense. Here's the population we're dealing with. Well, they're at the warming center every night. And so once the warming center opened, now Eric is just at Catholic Charities working out directly with Tracy Rieger over there. So they know, here's who was in the warming center last night. Who's having an issue? Who do we need to address? What fires do we got to put out today to prevent something from getting worse? And so certainly assistance or financial help to Catholic Charities is also great because they're helping us out with the same people. Eric And Catholic Charities are working very closely together with, here's Jim, and this is what Jim's issue is today or this week. How are we going to resolve this? And so, you know, Catholic, any donations to Catholic Charities likewise helps us out in our efforts.
And it certainly gives us all a lot to think about and as we go forward. Patrick, I'm catching you maybe off guard, but can I ask you to lead us in the four-way test as we leave our meeting today?
Bet. Be happy to. Of all the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And will it be beneficial to all concerned?
Thank you, Patrick, and thank you to everybody for being with us today. And we'll see you next week.
Thank you all.